Governor Reynolds, thank you so much for being here today. I've been to Iowa. I've spent a lot of time in Iowa. It's a beautiful state. So thank you for being here. Medicaid covers almost 700,000 Iowans, over a third of Iowa's children. In 2013, I believe, Iowa expanded Medicaid. I have a few questions for you. If Medicaid funding were to disappear, what would that mean for the people of Iowa?
Well, I don't think it will disappear. Simply looking at a system and seeing if we can enhance it and make it better doesn't.
That's not my question, though, Governor. My question is, if it were to disappear, what would that mean for your?
Well, I don't think that's the intent of anybody, but we need to do it better, and we need to help these
If it
kids
were to
be
disappear,
successful.
Governor, what would that mean for the
Well, I
people?
can't speculate on that because I don't believe that that would happen.
So you, as the governor of your state, can't say what it would mean to lose Medicaid for your people? Okay, we'll move on. How would people across Iowa react to rural and community health centers having to suddenly close?
Well, we're, as I talked about in my opening remarks, we're actually working on maternal health and working on healthcare in rural Iowa. And that means, again, looking at regions. I took, 32 fragmented substance abuse, and mental health regions and unified them into 7 behavioral health regions.
That's
and
great
we're
to hear,
putting in
Governor.
place a
Yeah.
hub and spoke model, which
That's
they will
great
be a
to hear,
part
Governor.
of.
I'm sure you're doing
But
great
again,
work. I
it's
want to
the
focus on
duplication that you
the
don't want to
questions
lose.
I have. I have limited time. I'm sorry, Governor.
Okay.
I'm sure you're doing great work on this. My question is about rural and community health centers.
Yep.
Community health centers that receive a huge amount of federal funding, including programs that help Iowans afford medication and prescription drugs. What would that mean for?
And they're a part of our solution, and we're taking that to account. But we don't
That's
want
good to hear.
duplication
Community health
we
centers
don't
are
want
part of the
duplication of
solution.
services so
That's
that we
good to
can
hear.
get
I'm
those
going to move on,
dollars on
Governor.
the
I'm going to
ground.
move on. That's
Yep.
good to hear. Some Republicans on this committee are calling Trump's careless assault on essential federal services, including his freezing of Medicaid payment system, rightsizing. What is the right size for health care?
Well, that's going to vary from state to state. So, I mean,
Would you be okay with Elon Musk or Trump right-sizing Medicaid in Iowa?
I don't think we should be afraid of having the private sector step in and take a look at how we're providing these services. We can
No
learn
one's
from
just
them.
taking a look, Governor.
It's both.
Decisions are being made.
Well, they're looking at the system and making recommendations,
freezing
and
the
we
Medicaid
shouldn't
payment system?
We shouldn't be afraid of that. So I think that
No one, Governor, no one is afraid.
we
Governor,
had to
sorry, I'm going to
look at-
reclaim my time.
Okay, thank
No
you.
one is afraid of opening, taking a look at what's going on. But what we are afraid of is our services, the things that people depend on being ripped away from us. I'm worried about Iowans losing the Medicaid that they voted to expand. 700,000 Iowans are on Medicaid.
But that's why we made the changes that we made. That's why we realigned, we eliminated the duplication, and by doing that, it put more money into the program to actually meet the needs
Well,
of
let's
our
talk about what you
constituents.
did, because we were just talking about what you did. You came to office, you made some changes to help with efficiency. I respect that. But there's something that was brought up even by the chair that I want to bring up that shows the difference between what you did and what's happening right now at the federal government. You worked with the legislature and passed legislation in your state legislature to make the broadest changes you wanted to make. And that is not what's going on right now when we talk about DOJ and everything else. You even mentioned at the beginning of this hearing, you were so proud to say that you did this all without massive layoffs, without forcing a large percentage of your workforce to leave because you saw them as valuable. I respect that, Governor. I respect you for that. That's not what's going on here at the federal level. But let's move on to FEMA really quickly. Okay. Trump has said that he wants FEMA to go away. He would like to see the states take care of the disasters on their own. I come from Florida. We work very closely with FEMA. Do you think most Iowans would agree with President Trump that FEMA should suddenly stop existing?
I don't think he's eliminating, and I think what I had understood was he was thinking that maybe it should go back to the states, which that's something I think we should take a look at.
Sorry, Governor, a reclaim. The president was very clear in this. He believes that the agency, FEMA, should be completely eliminated. Do you agree with that, or do you not agree with that? I mean, it's okay to disagree sometimes with,
Well, I'm not afraid to disagree. I'm just thinking,
do you disagree with FEMA, with his assessment of FEMA?
It's bureaucratic. It's a nightmare to work with. They can only do one thing at a time. I have
There's issues
impacted
with FEMA,
individuals.
maybe we
There are
need to fix
huge,
it. But do you
and
agree with him that we should
we could have a
eliminate
whole
it?
nother hearing
Governor,
on
sorry, I'm
that.
going to reclaim my comment. Do you agree with him that we should eliminate FEMA? Yes or no?
I think we need to take a look at it and how those
Take a look at
services
it.
are delivered.
But you don't think we should eliminate it?
I think we should take a look at it and see how those services are delivered.
Okay, but it sounds like you don't think we should we shouldn't get rid of it, which I agree with. In the past 10 years, your state has been granted FEMA support 10 times. President Trump in 2018 denied you a claim after flooding and horrible weather patterns that happened in Iowa. You said you were extremely disappointed and that the people of Iowa needed FEMA's help. That was your quote. And so, thank you. I'm glad you're here to talk about the things you did in Iowa. I hope President Trump can look at the way you did things and working with your legislature the way it's supposed to work to make the changes instead of letting a wealthy billionaire donor go in and make the changes himself. I yield back.
Chair Rick.